Hello, everyone. Welcome to Just for the Health of It, health expert interviews hosted by Warren County Public Health. I'm your host, Ignatia Shah, Public Health Program Coordinator at Warren County Public Health. And we're excited to talk to Dr. Molly Kovalesky today. Did I get that right?
Very close.
Okay.
Kovalesky.
All right. Okay. She's a board certified pediatric dentist at the Pediatric Dental Group of New York. Welcome. Thank you so much for taking the time to talk to us today.
Thank you so much. I'm looking forward to it.
Yes. As you are aware that February is Dental Health Awareness Month, and that's why we have the expert here to talk to us about dental health basics. Before we get started, would you like to tell us something about yourself?
Yes. So I'm actually originally from upstate New York. I have 4 dogs, and I just had a baby 2 months ago. One of my dogs I actually bring into the office on Tuesdays. Bailey, she's a little white, fluffy Samoyed, and she comes and gives all the patients and staff some love. So definitely something that brings a little extra fun to the office one day a week. So that's one of my favorite things about working here.
That sounds exciting. I think I would like to come and do that as well, to come and meet your
It's
dog at some
amazing.
point. All right, we can get started. And we're discussing about dental health. So some of the data that I came across was dental caries or cavities is one of the most common and one of the most chronic health problem that you see amongst children, which affects at some point, if it continues, it affects their growth and development and their academic performance and attendance. You work with children every day. What have you been seeing in the past few years or recently?
So I'm sure COVID had something to do with this, but a lot of us were home snacking. Cavities can really be related to like eating really frequently throughout the day. And so if you're somebody who's just kind of grazing on food, which is what we saw happen a lot while we were all home, we have been seeing a little bit increase in cavities and dental caries, as we call them in our profession. And especially in young kids who they were home with their parents, and they are frequent snackers. They can be difficult to say no to a lot of the time when they're home with you, bugging you like the 10th time for fruit snacks. So we're definitely seeing a bit of an uptick. And one thing that's a big barrier to care too is how do we treat these kids that have a lot of decay and things like that? Sometimes if they have a whole mouth that really needs to be fixed up because they have a lot of these cavities, if they're really nervous or scared, sometimes the best place for them to be is more in a setting where they're like completely out and we can just get all the treatment done in one setting for them. If they're really too little to be able to sit for all that work to be done. And so what you find is those schedules end up getting really filled up with those patients because we have so many people who need them. And there's just fewer resources available in the community for surgical centers and things like that, where you can do that type of procedure. So we find that there's also kids who they don't get the care in the amount of time that we always want them to, just because they have to wait so long just to get into an operating room or things like that. So there's definitely some barriers that we see to care for some kids too, which we try to do as the best we can to open those doors and get them the care that they need.
Yeah, absolutely. And I mean, as you rightly said, COVID plays such a big role in all of the other health issues that's going around. And I mean, dental health is not separated from any of that. Now, what age group does your clinic see? Do you see babies as well, or it's older kids?
So we see babies as early as they start having teeth, all the way to we see kids up to 18, 21 or so. We try to transition them out around that time to start trying to find a general dentist. But that's another barrier we find for some of our adolescent patients is finding a general dentist in the area who accepts their insurance and things like that. Can be a barrier for some people to get care. So it's important for me to focus on prevention and things like that too, since sometimes it is difficult for people to get all this work done and get it done in a timely manner where it gets done before the problem gets any worse. So I think right now with having such a backed up pool of patients at most practices, one thing to really focus on with your children is prevention. That way you don't feel like you're waiting too long for an appointment anywhere, since there was kind of a backup even still in 2024 that we're seeing since COVID.
Yeah, that is amazing. I mean, it's like Yeah, it's always playing a catch up to all the issues that we faced in the last 4 years, that it's like we're still catching up totally. And I know you mentioned you see babies and patients up to 18 to 21 years of age. So how would you explain it to our listeners as to how do you differentiate from brushing or cleaning gums for babies or their baby teeth to toddlers to older kids? Like how would you make it easier for parents to know or our listeners to know, like how does it differentiate from all the three different age groups, for example, what I've mentioned right now?
Yeah. So for instance, I just had my first child and
Yes.
I've been doing my best. Even I have to like tell myself, okay, this is something you should be doing is when you just have an infant, is try your best to incorporate if you start doing a bedtime routine if you just have like a little soft washcloth. Sometimes they even sell these little finger swipes that you can put on. Just wet it and like wipe their mouth, get them used to that oral stimulation, get them used to the cleaning of their mouth, because once something is part of their routine, they it's going to become part of their habit, and you're a lot less likely to fight them fighting brushing once they're a little bit older if you just start that from day one. They'll probably fuss in the beginning. My infant daughter didn't love it, but now it's just part of bedtime. Then what you want to do is the second your child starts getting teeth is when you want to transition more to a toothbrush. So that's when you want to do one of those soft bristle baby toothbrushes. And actually, the American Academy of Pediatric Dentistry recommends that as soon as the teeth come in, you can start with that rice-sized smear of fluoride toothpaste. A rice-sized smear is totally safe and for them to be swallowing. Once that they can start spitting typically around 3 years old, we'll have them graduate to like more of a pea size on that toothbrush. And even adults, you really only need a pea size. I feel like those toothpaste commercials give you like that whole strip of toothpaste just because they're trying to get you to run out of your toothpaste faster. So that's definitely what we'd recommend. Once your child starts having teeth, every night before bed, make sure you're brushing them. Try to do it in the morning too, those 2 times a day, but really just making sure they go to bed with clean teeth. And if your child is ever waking up in the middle of the night and has anything other than water, you either want to at the very least wipe off the teeth, or if you can, get a little brush in there. But as a new parent, I totally understand that you may be more going towards that washcloth than the brush if it's the middle of the night, because you don't want to wake that kid up. And then lastly, you have to start thinking about, well, when do I transition my child to brushing their own teeth? I think one mistake a lot of parents make is we'll transition them too soon because they are so independent and we think, oh, they can do it on their own. But what I want you to think of is they can do it on their own, but how good of a job are they doing? So if you gave them like a task at home to clean your bathroom, which they could probably physically like clean things, but how good of a job is that 5-year-old going to do at cleaning your bathroom? Like they can scrub the counter and they can scrub the toilet, but they're going to miss a ton of spots. Like it's just not, they don't have the development yet to understand exactly how thoroughly you want that to be cleaned. So I always say the best thing to do is give them turns, teach them they can have a turn after you have your turn. They don't get their turn until you have your turn. When it comes to flossing is going to be something that we really want you to incorporate into your child's routine the second that their teeth are touching. I always tell people have the kid do the front teeth and you can do the back. But we really do want you working with your child, at least helping them brush their teeth, doing a once over till they're about 7 or 8, because their actual motor skills are not there to really do a good job brushing. And then even after 8, it's going to be difficult because your kid's going to be annoyed with you. But I find that the 8 to 18 is when that you can't really prioritize your teeth. Your brain doesn't understand the consequences of what's going to happen by you not brushing your teeth. You can tell them till you're blue in the face, but it's not going to happen to them. So just kind of checking in and making sure that they're still doing what they need to be doing. And if you need to, when you go to the dentist, can you be like, hey, can you tell them why they really need to brush their teeth? Show them some pictures of what's going to happen. Because I do find sometimes that the teenage years can be a really tough one, and even young adolescents of being like, I don't really understand why I have to be doing this all the time. And it just seems like a waste of my time, but they'll start regretting that once they get in their 20s and 30s.
Yeah, and I totally can relate it. I have a 13-year-old and a 9-year-old, and my 13-year-old is a girl. She does a pretty good job, but my 9-year-old, he has to be reminded from time to time that, hey, I don't think you brushed pretty good today. I think you need to go back and brush it again. And but why? But why? I'm like, because these are the
Toothbrushing is a very low priority for 8 and 9-year-old boys.
it is totally low priority. It's like we are in and out, and then I have to remind them, I'm like, these are the teeth that's gonna stay with you till you turn 80 or 90. So take care of it now when you're 9, so they can survive till you're 90. So then he'll make a grumpy
Exactly.
face and go, but he gets it done. So far he's listening. We'll see how far that goes.
That's good. That's good.
Yep. So moving a little off topic, but still staying on the topic. I know Medicaid has been a little issue. I know your office does take Medicaid as well, but off late there has been news, and it has happened a few times, that there is shortage of dentists due to Medicaid. So I mean, in that situation, how does the dentist how does the dentist or the doctors handle that situation, and how would parents take care of that situation?
So we do find one thing that's a struggle is a lot of people are having a hard time finding a dentist that takes Medicaid or state insurance near them. So we have people, I mean, I just had a patient today who they stayed in a hotel last night to come see us this morning. So really, luckily with pediatric dentists, for the most part, they're available in New York State. It's just how far might you have to drive to see one? And if you're having any transportation issues, I would definitely recommend reaching out to the state departments and things like that and seeing, can you get like a Medicab or some assistance with getting to your appointments. I think really the biggest barrier we see with Medicaid patients isn't our very small patients, because most of our parents really do a good job of, they drive and they find us. When I find we have the biggest like gap in care is when kids start to get to the point where the needs are exceeding what we as pediatric dentists can do. So as pediatric dentists, we do a great job at doing stainless steel crowns for baby teeth, occasionally for some permanent teeth if we're just trying to squeak them by until they can get like a white crown at a general dentist. We do a lot of fillings, we do cleanings, but once you need more of a permanent crown, or you need like possibly a denture, or just some more extensive work, or especially crowns and things like that, where you need them in the front and those are your beautiful teeth, you don't want silver there. Then we want the kids to see a general dentist who can do that kind of work, who has more experience in that. But unfortunately, we have this big barrier of patients not being able to find someone who can do the work, especially with root canals is something that we find is if the cavity is deeper, it's into their nerve. We have a really hard time finding somebody who can do root canals for our patients. And so then we're just stuck in this limbo of, okay, well, you have these needs. We can't provide them for you because I haven't done that service since dental school. You don't want me to do that to you. Where do we send you? And so I find that that's really probably the hardest thing, is trying to find where to send these like late teenagers, young adults, to get their teeth worked on when they kind of exceed what we can do for them. How we've been managing it is we just try to do the absolute best job we can do as a temporary fix for them until they can get seen by someone. But it's definitely a challenge for us as dentists and really for the patients.
Yeah, definitely. And I mean, that is happening more than we know of. So, and as you said, you have them coming to you and drive, and they stay overnight at a hotel and then come to see you. So it is a burden towards the economy for getting dental care as well. So something to think about.
Yeah, 100%.
Sorry about that. Anything that you would suggest parents to do differently just to make dental health priority for themselves, for the children, especially for the children?
So when it comes to your kids, especially like I was saying, like once they become that like later elementary age or teenage age, and they just don't really want to do it, you want to frame it in things that they care about. So for instance, I try to remind kids teenagers like money. And so one thing I tell them is, by the time that your teeth are so bad that you really need them really fixed, or like a significant fix to your teeth, I point to who they're with, their parent or guardian. I say, that lady over there, that man over there, he's not going to be paying for your dental care anymore. It's going to be you who's going to need to pay for it. And do you want to spend your money on your teeth, or do you want to spend money on like a car or something fun that you want, that you'd rather have? And a lot of times that mentality, teaching it in things that they care about, like, oh, I don't want to spend my money on my teeth. Because a lot of times telling them their teeth are going to decay and fall apart and all of those things, you can tell them that till they're blue in the face, but it just for some reason doesn't really like hit until you start being like, oh, well, your own money's going to be taken away, or, oh, well, no girl's going to want to kiss you. Like those type of things you want to remind your kid. Because you want to think of their terms, the things that are important to them and what matters to them, because at this point, a lot of times just having good health is not something they're really thinking of for the future. And then when it comes to your younger kids, I say just try to motivate them any way you can. A lot of times you can do like rewards charts if you really need to get them on to toothbrushing. There's a toothbrush that I like by Hum that's for kids, and I don't even think it's that expensive. And I think it connects to an app and you can play games while you're brushing your teeth. So that's another way to kind of motivate the YouTube generation of kids, is just make it a little more fun for them. So that toothbrush may be a good investment for you, like less than $50, and your kid might start brushing their teeth.
Yeah, that is a great suggestion. And I would totally agree. I think anytime it comes to money or being around their friends, and they say, if they get a comment from their friend that, oh, you don't smell good, I think that kind of does it for them. And money,
Yeah.
absolutely. I think those are great, and those are great ideas to be used for all of our listeners, whoever's out there. So thank you for sharing those.
You're welcome.
Anything else that you would like to suggest or advise before we wrap up our conversation?
Yeah, so I guess I would just like to give a couple tips for things. I think
Sure.
one thing too is to, when we just say you got to brush your teeth because you're going to have cavities, like that doesn't really, I don't feel like that's enough of an explanation to really explain what's going on. So when I have patients come in and they struggle with getting cavities, I try to talk to them about why. So I just let everybody know cavities are caused by bacteria. So I tell kids a lot of times if bacteria is a little too complex, I say it's caused by germs, because we've been talking about germs a lot the past few years. Kids should know about that. And so I tell them, how there's germs that make you sick, there's germs that make just your teeth sick. And some people have germs that turn their food, sugar, and carbs to acid. And that acid sits on your teeth if you don't brush it off. And you need to floss because the brush can't get between your teeth to get the acid out from between your teeth. Then that acid dissolves holes in your teeth. I tell them sometimes you won't have the germs that dissolve your teeth that make cavities with the acid. Sometimes you'll have germs that they attack the gums and the bones around your teeth, where if you're not brushing your teeth, even if you don't get cavities when you're older, if you have all those germs around your teeth, what happens is your bone runs away from those germs and it runs away from your teeth. And so then your wonderful, nice, strong teeth start getting loose and falling out. So those are the terms that I try to explain it to kids and let them know that, hey, these are real things that can happen to you. And then usually what happens is their parent either points at all of their dental work from cavities, or they point to their tooth that they lost from gum disease and don't end up like me. I will still admit the frontal lobe is not present in these kids. So even with like good explanation, sometimes it still doesn't work. But sometimes you see that light bulb go off, like, oh, wait, there's acid on my teeth. And my teeth, even if I don't get cavities, I still need to brush my teeth. And that's why, because there is a good percentage of the population that doesn't really have the cavity bacteria. And so for them, they've never had a cavity and they're not brushing their teeth because they don't think they need to, because they've never had a cavity. And that's when you really will end up with gum disease sneaking up on you in your 20s because you haven't been brushing your teeth because you didn't think you needed to, but you did.
How can Warren County Public Health help you and as being a part of the community with dental health?
So I think things like this are great. Giving education and having everyone understand why this is important. Just being active and engaged in the community. I know before we discussed water fluoridation, having that be a priority for the community is something that it's been one of the most cost-effective ways to prevent cavities since like the 1940s, and something that I think all children should have right to have access to. So definitely having public health in our corner is something we're very grateful for, because it's definitely a community effort to get everybody healthy and with beautiful smiles.
Yeah, I totally agree on that. And I mean, we do have some of the dental health program being Dental Health Month. We do have one of our health educators who goes to schools based on the programs that they have, and they do dental health education amongst all different age groups.
Love that.
I know. So that has been going on. I know my colleague who sits right next to me, Katie, she's our health educator, and she has been going to all schools to do dental health education. So
and I honestly find kids, they'll come home, they'll tell their parents about like what they did in school, and they make it fun so that I think that those are some of the best things to really get kids engaged and start the conversation about their teeth and why they're important.
Is there anything else that you would like to add?
Just that if you are looking for a dentist for your child, we have locations in both Glens Falls up here in Warren County. We also have locations in Albany and Schenectady. We are taking new patients, and we are happy to work with you and your child, especially if there's any anxiety on either end. It's definitely something that I personally am passionate about, and we have a lot of great dentists with different assets and skills that will be able to take care of your child for you.
Perfect. Thank you. Well, thank you so much, Dr. Molly, for taking the time. And this is Jignasha Shah, your host from Warren County Public Health, signing off. Thank you for listening. Thank you.
You're welcome.